Loose motions during pregnancy. Are they normal or are they any danger to your baby during pregnancy? Many women think that loose motions are just normal during pregnancy, but what if they lead to labor contractions, premature labor? What if they lead to dehydration? Hi, I am Dr. Rajat. Today I will discuss everything you want to know about diarrhea in pregnancy. When diarrhea is normal, what are the causes of diarrhea in pregnancy, what to do, the home remedies of diarrhea in pregnancy, and by the end of this video, you will know certain home remedies, the medicines to take for diarrhea in pregnancy, and watch till the end what you can do to control diarrhea in pregnancy. Hello, I'm Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. Pregnancy is a wonderful condition for female. In pregnancy, a girl becomes a woman after she delivers. It is a wonderful period of hormonal changes, but that hormonal changes, apart from the joy it brings, apart from the hope, apart from the happiness, it also has its ups and downs. And hormonal changes, the GI disturbances, they are all the part and parcel of the package which a pregnancy brings. So why does diarrhea occur in pregnancy? Is diarrhea normal part of normal in pregnancy? First of all, let us understand, as I have discussed in my previous videos, pregnancy is an immunocompromised condition. God makes immunity down for a female so that she can accept the pregnancy, because a embryo contains the part of sperm which is a foreign to the female body, and our body, our immunity has a thing that whatever foreign body comes to our body, it has a tendency to reject that thing. So pregnancy, because it is a foreign thing, it would get rejected, and that is why many females who have got an autoimmunity or an increased immunity, they tend to have a recurrent pregnancy loss or infertility. So because by the virtue of pregnancy being an immunocompromised conditions, females are at more risk of getting routine infections which other non-pregnant females do not get. And diarrhea is one of them. Most common cause of diarrhea is viral infection or a bacterial infection, that I'll come to it later on in the video. But like I said, pregnant women, because of the hormonal changes, estrogen causes some disturbances in bile metabolism, progesterone causes lower it causes GI stasis, the food stays longer in this. So there are bound to be GI upset, SCG causes vomiting, there is an immune disorder problems. Pregnant women are also sensitive to most of the things they eat. In non-pregnant females, who normally what happens is, if a female is not particularly sensitive to one particular thing, but the same thing, a pregnant female can become sensitive. These are the causes. And infection, viral infection, the rotavirus infection, the bacterial infection, anything eat from outside. I always mention to my patients in pregnancy, nothing has to be eaten from outside, hotel, restaurants, laris, street foods, because of the hygiene level you are not sure. Not many restaurants, not many lari, not many street vendors, they use a proper hygiene. The water may not be good, they may not be practicing standard hygiene practices, and then that can lead to an infection, GI infection, it can lead to gastrointestinal infection, it can lead to typhoid, it can lead to food poisoning, and that may lead to diarrhea. And also one of the most common causes, lactose intolerance. Most of the women who are normally lactose intolerant, that lactose intolerance worsens in pregnancy, and that may lead to a diarrhea. So what do we exactly define diarrhea as? What is exactly diarrhea? 1 or 2 loose motions does not qualify to be diarrhea, but if female has loose watery passage of stool for more than 3 to 4 times in a day, that's what we define as diarrhea. Why diarrhea is important in pregnancy, and why as a gynecologist I am worried about diarrhea? First and foremost, if diarrhea is occurring, then the female is losing lots of fluids in her body, and that may lead to dehydration. She is also losing electrolytes, sodium and potassium, and that may also lead to certain problems, the weakness and the other problems that comes along with it. But as a gynecologist, why I am worrying is diarrhea, if it is because of infection, it can precipitate uterine contractions, it can precipitate preterm labor, and that is what I am worried. Most of the causes of preterm labor are because of undiagnosed, untreated infections, whether it is a respiratory tract infection, whether it is a GI tract infection, whether it is a urinary tract infection, or whether it is a vaginal infection. And that is why I always make it a point to treat the infections promptly. So suppose a female has got diarrhea, the first thing she will call me, sir, I have got diarrhea, what should I do? The first and foremost thing I always advise, if there is no vomiting, then you have to rehydrate yourself. Diarrhea means you are losing fluid from your body. Everybody needs at least 3.5 liters of fluid per day. So rehydrate yourself. Drink plenty of liquids. And the best rehydrating solution is an ORS, oral rehydration solution. It is available in the market. WHO certified ORS only has to be taken, not any kind of ORS which are being sold under the garb of ORS. Only WHO certified ORS. It has got specific contents which needs to be taken because it replenishes electrolytes along with the fluid. Now, there is a specific way of preparing the ORS. You should take 1 liter of, first of all, you boil 1 liter of water. Boiling is important, not heating. Boil 1 liter of water, let it cool, put 1 whole packet of ORS and drink that ORS as frequently as possible instead of water. Suppose you are alone at your home and ORS is not available, then there is a homemade remedy for an ORS. Take 1 liter of water, boil it, put 1 tablespoon of black salt in it, put 1 lemon and 1 approximately 100 grams of sugar in it, and drink that water. That is lime water, that is lemon water, that is equivalent, almost equivalent to ORS. That will also replenish the electrolytes. First and foremost thing is to replenish the fluid, to rehydrate your body. That is the one of the most important thing. Second thing is what type of diet you should eat. They say you should eat a BRAT diet, B-R-A-T. B for banana, R for rice, A for apple, and T for toast. Basically, you have to eat fruits like banana and apple, which have got good amount of starch, carbohydrate, and good amount of potassium in it. You have to eat anything made from rice. Either it can be simple dal chawal, it can be khichdi, it can be kodri, it can be poha, which is slightly cooked, steamed, not very spicy. And you can have toast. What this will do, this will help in firming up of the stool. This will help in stopping, it will help calm the digestive tract. You can have cooked vegetables, but you should avoid anything spicy, anything excessive salty. You should avoid sugary drinks because they will, again, by the way of osmosis, they will take the more water out. You should avoid fruit juices. You can have nariyal pani if you want because it has got good amount of electrolytes in it. Take simple homemade food. You can have couple of, you need to avoid soda, you need to avoid coffee, you need to avoid dry fruits, you need to avoid meats, but have simple dal chawal which has a calming effect on your stomach. Secondly, I always tell to my patients, Rydol is the brand name, loperamide is the molecular name. It works wonders in stopping the diarrhea. Take 2 tablets of Rydol, loperamide or acicadrotil, 2 stat under the guidance of your doctor. Again, I am repeating, please do not take it yourself, but always have this tablet along with you. Take 2 tablets of loperamide stat and wait for 4 hours. If the frequency of diarrhea does not decrease, either you can repeat the 2 tablets or you can visit the doctor. And probiotics is an excellent way to stop diarrhea. Pre and probiotics. Our intestine is made up of good bacteria. Those are called commensals. They also are called probiotics, which help in the lining and they prevent the invasion of the infection. And those probiotics like lactobacillus, they are wonderful in preventing or in management of diarrhea. They cut short the duration of diarrhea, decrease the frequency and decrease the severity of diarrhea. I normally give any probiotic which is available in the market, 2 tablets thrice daily for first day, followed by 2 tablets twice daily for second day, followed by 1 tablet twice daily for third day, and by the third day the diarrhea is hopefully gone in most of the cases. If along with diarrhea there is a vomiting, that would clearly suggest to me that there is a food poisoning. And if vomiting is there, then patient cannot take the tablet orally, then I call the and patient cannot take the oral rehydration solution. In those kind of patients, I normally call the patient to my hospital, start the IV fluids. Again, IV fluids needs to be replenished at least 3.5 liters per day. If along with diarrhea, along with vomiting, there is an abdominal pain, colicky abdominal pain or associated fever, that would suggest to me that there is an infection component, and in those cases I start an antibiotic. Now this replenishment of fluid and IV antibiotics, by starting IV antibiotics, IV fluids, most of the patients, they have control in symptoms in about 24 to 48 hours. Once the vomiting stops, once the diarrhea stops, then there is no need to give IV fluids, there is no need to give IV antibiotics, but the course of antibiotics has to be completed. There is no antibiotics which needs to be taken for only 1 to 2 days, at least 5 days or possibly 7 days, 5 to 7 days of antibiotics needs to be taken, or ORS needs to be taken for a couple of days more to rehydrate the body, and probiotics needs to be continued. What can be done to prevent diarrhea? Like I mentioned, there are 4 things which are very important. In pregnancy, like I mentioned, there are hormone disturbances. Most of the females are already taking iron tablets, which again leads to GI tract disturbances in the pregnancy. Immunity is down, that is why the females are at more risk of any kind of infection, especially GI infection. So what should one do? A, those females who are prone to diarrhea before pregnancy, they should avoid 2 things. One is lactose, that is dairy items, and they should avoid anything which are too spicy or too sugary. B, avoid anything which is made from outside, any larry, street food, any food from restaurants or hotels or a place where you are not sure of hygiene. 3, do not go to a mass gathering, the food where it is made for many people, because there the chances of infection are maximum. And 4, even if you are sure of the hygiene at the place, always take your own water with you. Again, I always tell my patients in pregnancy to boil the water, then cool it and then drink it. Most of the females and most of the relatives counter me by saying, sir, hum to RO wala pani peete hain, we drink an RO water. RO is basically meant to decrease, to normalize the TDS impurities. It can take care of the chemical impurities, but the bacteriological impurities are not taken care of by RO. And that is why I would always recommend, especially for the people who are taking RO from the jug, that is, they are buying that jug outside, you are not sure of the cleanliness or the hygienic practice, and that is why it is a good practice to always boil the water and then drink it. What I say is, it is very difficult for a female to boil water for her alone and drink it. What I say, suppose in your family you require 5 liters of water per day to drink. Take a big 5-liter pan, put it on the stove or a gas, boil it, cool it, and then drink it. Make it a habit so that everybody in your ward home drinks boiled, cool water. Some people say we drink boiled water in the morning, boiled water in the evening. I say every time you have to drink water, you have to drink water which is boiled. And the diet has to be bland, not much spicy and not much sugary. So 3 things are important for diarrhea: to prevent dehydration, to prevent uterine contraction, and to take care of the infection as soon as possible. To prevent dehydration, we need to rehydrate. If patient is able to take orally, the ORS is best. It is very cheap. If you are not able to get ORS or you are alone at home, make simple nimbu pani. You can have it as often as you like. Second thing is, to prevent the uterine contractions, you need to treat the infection, and that has to be done fast. If patient is not able to take orally, you need to start IV antibiotics, but if patient is able to take orally, you need to take oral antibiotics for 5 to 7 days. And thirdly, for prevention of further episodes of diarrhea, probiotics is an excellent thing. Hope you like the video. Please comment, please ask your questions, please subscribe to our channel, and please share. Namaskar, bye bye.